Chair recognizes Ms. Kaptur for an amendment.
Oh.
The other vote's postponed until our colleagues return.
All right, Mr. Chairman, I guess this is number 3. I'm not sure.
Is this a new amendment, Ms. Kaptur?
This is a new amendment. I've been busy over here.
I know you have. That appeared after we went to have a vote. Oh, boy. Ms. Kaptur, it's recognized. Consider the motion, the amendment read?
Yes, as read, Mr. Chairman.
This is Kaptur number 3.
All right.
Gentlewoman's recognized for 3 minutes. Thank you.
Licensing of federally owned medical inventions. I rise to offer this amendment directing the Department of Health and Human Services to use its licensing authority to help negotiate lower prices on prescription drugs, vaccines, and other medical technologies. I want to highlight the fact that HHS already has this authority. It's called the Bayh-Dole Authority, and my amendment would simply tell them, use it. Specifically, if a drug is developed by using U.S. taxpayer dollars through the Department of Health and Human Services, and the price charged in the U.S. market is higher than the developed world, the rest of the developed world, HHS would be directed to use its existing rights under the Bayh-Dole Act to encourage competition and lower the price. So, if the public paid to help develop it, and America still pays more than most nations, HHS must take action, and the price decrease would benefit all Americans.
In support of the Kaptur Amendment, it would help to reduce the price of prescription drugs that were developed with the support of taxpayer dollars. As we discussed earlier, pharmaceutical companies are earning record profits, while patients and taxpayers face higher and higher costs. These companies grow their businesses with the benefit of taxpayer-sponsored research. They then turn around and they gouge those same taxpayers, and they put life-saving medicine out of the reach of many. I want to be clear, very clear. Not all companies have engaged in these predatory practices, but we must hold the bad actors accountable. For example, and Ms. Kaptur made reference to this, U.S. taxpayers funded the research at UCLA that eventually led to a patent for Xtandi, a drug to treat prostate cancer. The drug was subsequently sold back to taxpayers at $130,000. That is just not right. Pharmaceutical companies deserve to make a profit for their innovation, but taxpayers deserve access to life-saving drugs at reasonable prices.
Americans are struggling with the forever rising costs of medical care. How many of your offices, as does ours, spends hours and hours and hours on the telephone trying to get pharmaceutical companies to donate medicine because your constituents simply can't afford it? How many of you have met constituents who cut their epilepsy pills in half because they can't afford their medicine? It goes on with thousands and thousands, tens of thousands of people across this country. So I think that we can't afford not to try something. This is legislation on the books. What's wrong with trying? What's wrong with trying to do something, even if on a limited basis? Let's use all the tools in our toolbox to reduce the medical expenses for all Americans and to get back to the American people some of what they've invested on their own behalf, rather than siphoning it all off to companies that are charging exorbitant rates for the medicines that they sell in this country. Please support this amendment, and I yield back.
Okay, thank you. Thank you, gentlewoman. The questions on the Kaptur amendment, all those in favor say aye.
Aye.
All those opposed say nay.
No.
In the opinion of the chair, the nays have, and the amendment is not agreed to.